In a 30 to 34-year-old, half of the eggs are chromosomally abnormal. By 40, it's about 90%. And that's why we put eggs in the freezer.
It's finally time. We're finally doing it. Today is Fertility 101, egg freezing. I feel like we've been preparing for this day for years. When I started at Progyny, egg freezing was really starting to pick up steam. It was no longer considered experimental, and some large and well-known employers were starting to actually offer coverage for it. So, ever since then, we've been spending a lot of time speaking with different doctors and patients about egg freezing, aka fertility preservation. So I think we're really ready to do this today. But not only is it finally here, we also have a really wonderful guest to help us out today. It's Dr. Anate Brauer, the IVF Director at Shady Fertility in New York. I'm Dan Bulger with Progyny, and this is Infertility. All right, let's jump right in and get to know today's expert.
Hi, my name is Dr. Anate Brauer. I am a reproductive endocrinologist and infertility specialist and the IVF Director at Shady Fertility in New York.
The first question for Dr. Brauer is the obvious one. What is egg freezing?
So egg freezing is the ability to stop your biological clock. We are born with all the eggs we'll ever have, and we lose them over a lifetime. So when we evaluate the ovaries, we care about two things, egg quantity and egg quality. So egg quantity is how many eggs you have left, which we lose over a lifetime, and egg quality is the quality of those eggs, meaning the genetics of those eggs. So as we get older, not only do we lose eggs, but the eggs that we retain age. So they get more and more DNA mutations, which leads to an egg with the wrong number of chromosomes, which either won't fertilize or will fertilize and not implant, or will fertilize and implant and lead to a miscarriage. And there's no blood test we can do on you. There's a blood test we can do on you for quantity, which I'm sure we'll talk about. But for quality, we just base that on percentages that we know from the hundreds of thousands of embryos we've tested through IVF. So for example, in a 30 to 34-year-old, we know that there's about half of the eggs are chromosomally abnormal. By 40, it's about 90%. So, and that's why we put eggs in the freezer. It gives us the ability to put them in the freezer when we have more of them and when they're better quality.
Now that's a pretty broad overview, and we're going to dive into the nitty-gritty in just a bit. But first, let's learn a few different reasons that someone might need to or choose to freeze their eggs.
So I look at egg freezing in two broad categories. Category 1 is medical egg freezing, and in that category, we have patients who unfortunately have been diagnosed with cancer at a young age or an autoimmune disease that requires them to go on a medication that they can't be on for conception, or anyone interested in gender-affirming surgeries, or anyone who has endometriosis, which is can be a severe disease. It's destructive to the ovary. And so all of those and some others are grouped in medical egg freezing, which is a wonderful technology that we have to help those categories of patients.
Yes, so that's category 1, where we're talking about things like cancer and endometriosis and other medical reasons where egg freezing is absolutely called for. Then there's the other category, where egg freezing is solving a very serious and fairly modern problem that many with ovaries face around the world today. And that used to be called social egg freezing, and then people started to call it elective egg freezing. Now, neither of those words really capture it. Social and elective, they downplay the real need for egg freezing in this case. But the general idea is that this is a category of people who are using egg freezing because for one reason or another, they're not in a position right now to have a baby, and they need to preserve their fertility for the future. And this leads to another question for Dr. Brauer. For those in that second category, what's a good age to freeze eggs?
In general, if someone were to ask me what's the best time to get pregnant in your life, I would say in your 20s. So theoretically, the earlier you freeze eggs, the better. But I don't think that necessarily applies to age cutoffs with egg freezing. So I think that depends on several factors. One is, what is your ovarian reserve, right? How many eggs do you have right now? And one of the first steps to all of this is just doing testing. We do a test called AMH, which is a blood test. It's looking at a hormone called anti-Müllerian hormone that's made by the small resting eggs in the ovary. So the more eggs you have, the more AMH you make. So for example, if you have a really awesome ovarian reserve and you're young, meaning in your 20s or early 30s, you may not feel so pressured to freeze your eggs right away. But let's say you're 25 and you have a lower AMH, then I may tell you, okay, maybe you should consider freezing. Or let's say you're 33, which is still very young, but if you think about it at 33, if you're planning on going down a traditional path, which not everybody does, but assuming that you are, by the time you meet somebody, date, get engaged, consider marriage, now before you know it, you're 35, 36. And at that point, we know that at 35 is when percentages start going up of more and more genetic abnormalities. And so I don't have a cut and dry age. I have women that see me sometimes very young who are 25, 26. Most of my patients are in their early 30s. That's kind of the sweet spot that I see most. And I also have patients in their later 30s and even very early 40s, which if you have a really good ovarian reserve and a really good AMH, you may still be a good candidate for egg freezing.
All right, let's get into it now. What is the egg freezing process?
To understand the process itself, you should understand just what happens in a natural cycle. So every month you start with a group of resting eggs. Your brain makes FSH. Your brain makes only enough FSH. FSH is follicle-stimulating hormone. It stimulates a follicle to grow. A follicle is a sac of fluid that houses eggs. So your brain makes FSH, only enough FSH to grow one egg. That egg grows. As it matures, it makes estrogen. That estrogen then tells the brain, okay, I have my mature egg for the month. You can stop making FSH. The FSH is cut off. The rest of the eggs die off. Then your brain makes another hormone called LH that leads to the final steps of maturation and eventual ovulation of the eggs. So everything we do is based on what happens in a natural cycle. When we're trying to stimulate someone's ovaries to grow eggs to retrieve them and freeze them, we don't want your brain to make only enough FSH to grow one egg. We give you FSH through injectable medications to allow the growth of multiple eggs. We want to feed the follicles to grow. We don't want them to starve them, right? So you're taking these injections for about 10 to 14 days. During that time, we're monitoring the growth of your follicles by coming in every 2 to 4 days for an ultrasound where we can actually measure the follicle at an estrogen level that also gives us a sense of egg maturity. When the follicles have reached a certain size and the estrogen reaches a certain level, we mimic that LH surge that your body normally has. So we trigger the final steps of maturation. Instead of letting you ovulate, we take you for an egg retrieval. So an egg retrieval is about a 20-minute procedure. It is done under anesthesia, so you get propofol through the IV. You're not intubated or anything like that, but you are sleeping. And we use a transvaginal ultrasound probe with a needle guide at the end, and we're able to suction out all the fluid from all the follicles. Within the fluid live the eggs. The embryologist identifies the mature eggs and puts them in the freezer. And now they're there for you for whenever you want to use them.
So that's the process, but let's talk a little bit about practicality here. Like, how long does this take, and should people plan to take lots of time off work?
So it's about a 2-week process. It depends on how you stimulate. Some patients have a very quick stimulation. Some patients have a little bit of a longer stimulation. But the stimulation itself is about 10 to 14 days. Then you're triggered. Your retrieval is 35 to 36 hours later, so 2 days later, and then you're done. Most patients are completely able to go to work every day. Of course, the appointments can be a little bit of a nuisance, but most IVF centers open very early in the morning so that patients can come in at whenever, 6:45 or 7, and scoot on to work. The only day you have to have off is the day of your retrieval because you will be under anesthesia. If you have the luxury of taking the next day off, most of my patients go back to work, but if you have that luxury, take it off because you may still be a little bit groggy or bloated or crampy from the procedure.
All right, so time-wise, it's not really that bad. It's about 2 weeks, and you only need to take 1, maybe 2 days off for the entire thing. But what about effects? Are you going to feel tired the entire time? Maybe moody and hormonal?
So most patients feel totally normal. In fact, they come into monitoring and they say to me, I don't think I'm doing the medication wrong because I feel nothing different. So that's the goal. So I'd say about 90% of patients feel fine. Towards the end, you do have some bloating and cramping, just because by definition, we're stimulating your ovaries to grow multiple eggs, right? Your body's not used to what that feels like. So you do have some bloating or cramping towards the end. A lot of patients ask me about how they're going to feel emotionally and am I going to feel crazy? The fertility drug that makes people feel like they're having mood swings, which happens about 10% of patients with a drug called Clomid, which we actually rarely use for egg freezing. The injectable medications, most people feel fine. I have a small subset of patients that feel very energized on the medications. I have a small set of patients that feel tired on the medications, but in general, most people feel fine. They just have some bloating and cramping towards the end.
We've already talked a little about how relatively simple this all is. It's weeks long, and the effects are likely going to be minimal. But it is important for anyone pursuing this to be aware of the risks.
First, there's a risk of the procedure itself, right? So a retrieval is a surgery. It's a small surgery, but there's no such thing as a small surgery. You're putting a needle in an ovary. So there's a risk of bleeding, infection, damage to surrounding organs, exceedingly rare. It's a 0.2% complication rate. There's also something called, if you were to Google risks of IVF, you'll see ovarian hyperstimulation syndrome, OHSS. This happens when you have a very robust response to stimulation. You're growing a lot of eggs, and then you're exposed to the hormone of pregnancy, which can lead to an inflammatory cascade, and then you can collect fluid in your belly, fluid in your lungs. Not a good situation. By definition, ovarian stimulation is hyperstimulating ovaries, but I mean collection of fluid, which is not normal. There are two potential places within a cycle where HCG can be found. That's the hormone of pregnancy that really kind of leads to this cascade of inflammation. The trigger shot, so traditional trigger shot has HCG in it. For my egg freezers, or anyone that's going to have a robust response to stim, I only use what's called a Lupron trigger. That makes you have your own endogenous LH surge, avoids having the need to use HCG except for in very specific situations, which you'll be counseled on, or pregnancy. So you don't want to get pregnant during this fresh cycle because that can trigger inflammation and OHSS as well.
Okay, now let's get into what Dr. Brauer calls the million-dollar question. How many eggs does someone need to have frozen in order to have a baby?
At this point, there is data on this. So we published at SGF a very large study of babies coming from frozen eggs, and we basically took all of our data over about a decade and worked backwards to say, in this age group, how many eggs did this woman need to create that baby? And we found that in our 30 to 34-year-olds, if you have 20 mature eggs in the freezer, you have about an 80+% chance of having at least one baby from those eggs, and about a 60% chance of having the second, and about a 30% chance of having the third. So in my 30 to 34-year-olds, I want them to have at least 20 mature eggs in the freezer. That's different than the number of eggs you have retrieved. Not all eggs that are retrieved will be mature, but that's generally what we're looking for. The older you get, the more you need. So for example, the 37 to 40 age group, you need about 30 eggs in the freezer to get those same numbers. So, and how many retrievals it's going to take to get there really depends on your AMH level. So for example, if someone has an AMH of 1.0, I would expect them to get about 8 or so eggs with a retrieval. Or if someone has an AMH of 3, we maybe will get 15 to 20. So that's how we look at those numbers.
Okay, now this is what I consider a classic egg freezing question or concern that I've spent a lot of time speaking with people about just in my life. It's centered around the core idea of egg freezing, really, so it's a concern that I totally understand. So we've already established that women are born with all the eggs they'll ever have. They aren't generating new eggs as they go. And so, as time goes on, they are depleting their egg supply month by month. And we know that generally women ovulate just one egg at a time. So the concern goes like this. If that's the case, if women are running out of eggs as they age and they're ovulating just one egg a month, then if we do egg freezing and we retrieve, let's say, 20 eggs that month instead of just one, well, aren't we in effect depleting the egg supply and therefore causing early infertility or even menopause? It's one of those concerns that seem like it must be right, but fortunately, that's not actually how it works.
At the beginning of your cycle, you start with a group of resting eggs. They're called antral follicles. One of those is chosen to be the one that ovulates that month. This is in your natural cycle without taking any medication. So you start with a group of follicles. Your brain makes a hormone called FSH, follicle-stimulating hormone, that tells the ovary to grow an egg. One egg grows, and then the rest of them die off. And so every month you're losing eggs. So the eggs that we're retrieving, we're not going into resting stores that are not kind of primed to potentially be that one egg in the month. We're basically putting in the freezer what you were going to lose that month anyway. And this has been studied specifically in donors. So egg donors can donate up to 6 times. And so there have been studies looking at AMH levels in egg donors and basically showing that there's no differences in AMH or age of menopause or any of those things, because we're not going into resting stores. We're only putting in the freezer what would have been lost anyway that month.
Okay, so egg freezing is not doing anything at all to deplete a person's egg count. And as we learned earlier, the ideal number of eggs to put in the freezer seems to be about 20 eggs. But what about those who don't get 20 eggs when they go through their egg freezing cycle? Can they do another round? Can they do the second round right away? Or do they have to wait?
As far as doing back-to-back cycles, that really depends on what protocol you're using. So most doctors will use some kind of pre-treatment before actually starting the injections for your stimulation cycle. So for example, let's say you do a retrieval, you get a period 2 weeks later. If your protocol is what's called a straight start, you go straight into starting your injections if your ovaries look good. Or let's say they're still healing, your doctor may put you on a birth control pill for a week or two just to let things settle down. There's also other protocols that incorporate an estrogen patch, which take a little bit longer. But you inherently have a little bit of time between retrievals, and most people do just fine with back-to-back cycles.
This is all good news. You can do egg freezing multiple times to reach your target number of eggs. But of course, it's not exactly that simple. Egg freezing is very advanced medicine, so it's not exactly cheap.
Depending on where you go, it's anywhere from $6,000 to $10,000 for the cycle itself. Usually that includes everything. It includes the monitoring, meaning all the ultrasounds and blood work that you'll need. It includes the retrieval itself. There's also an anesthesia fee that some centers put into the global fee, or sometimes it's separate if the anesthesiologist bills through your insurance separately. And then another big cost that a lot of people don't really consider is the medication, which can be very expensive, sometimes just as expensive as the cycle itself. And that's an issue because it's adding thousands of dollars to your baseline cost. So it can be expensive. Thankfully, more and more companies are covering this. More and more insurances are covering this. And so I do think, I would say now about more than 50% of my egg freezers have some kind of coverage. So I don't want anyone out there to just assume they don't have coverage. Whatever you go, whatever doctor or center you see, when you first meet, they should take down your insurance and kind of do an explanation of benefits and look into your benefits to tell you what you are and are not covered for. So don't just assume you don't have coverage just because that's kind of what the mainstream think. You should always look into it for sure.
As Dr. Brauer mentioned, these days more and more employers are opting to cover egg freezing for their employees. So yes, if you're on the fence about this, one of the first things you should do is find out if you have coverage. And if you don't, well, don't give up. You can talk to your HR and benefits team and request that they add coverage. Now, that can be daunting, we know. So at Progyny, we've got you covered. You can visit us at progyny.com/talk-to-HR. And there you'll find a ton of resources that can help you have this conversation. Okay, so we've covered the process. We've talked about some reasons that people might need it, and we've talked about the cost. So we only had one more question for Dr. Brauer. We asked her that if she could speak directly to someone who is currently on the fence about whether or not to go ahead with egg freezing, what would she say?
You will only regret not doing it sooner. I have so many patients who think about it, and they come see me, and they come back 6 months later and a year later, and I see a lot of patients who are friends with each other. And so recently I saw two girls who are friends, and they went and had dinner, and they were talking about potentially doing this. And then one of them, got her period, came in straight away and did it. 2 weeks of sim, had her retrieval done. And then 2 weeks later, her friend comes in and she said, I can't believe she already did it. Like, we just had dinner, a month ago. And I said, yeah, well, it's 2 weeks of stimulation, have a retrieval, and you're done in most situations. And so I think making the decision to do it and taking that first step, I think is the hardest part. And then once you do it, you should just feel empowered by it and say, okay, I checked the box. I don't have to stress out about that anymore.
As we've talked about, there are many reasons someone might need to freeze their eggs. There are some instances where it's nearly an emergency, like for a person who can't wait before starting treatment and must freeze their eggs immediately if they want to preserve their fertility. And then in other cases, it's far more planned, where someone sees that they aren't going to be trying to conceive for the next few years and knows that now is the perfect time to preserve their chances of success down the road. If you're interested in egg freezing, you can learn a lot more about it at progyny.com/education. And of course, we have a lot of egg freezing videos available for you on Progyny's YouTube channel. I want to thank Dr. Anate Brauer from Shady Fertility in New York for being on the show with us today. And of course, I want to thank you for joining us too. If you want to connect with us, you can do so on Instagram at This Is Infertility Podcast. If you want to follow Progyny, you can do that at Progyny Inc. Of course, if you're listening on a podcast app, please leave a rating and review, as that's a huge deal for us. And if you're watching on YouTube, well, gently click the like button. It's just as good as smashing it. This is Infertility is brought to you by Progyny. Please remember this podcast is not intended to substitute for the personalized, expert advice of your physician. I'm Dan Bulger, and this is Infertility.